Hello, and welcome back to PCOS Wellness. In today's video, we'll be diving into the 4 types of PCOS and tips on how to manage them. Whether you've been recently diagnosed or are looking to expand your knowledge, this video is for you. PCOS is not a one-size-fits-all condition. It manifests in various types, each with different challenges. Understanding these types is essential for effective management and tailored treatment plans. So let's get started. Type number 1, which is the most common type, is known as insulin-resistant PCOS. Insulin, a hormone produced by the pancreas, helps to regulate blood glucose levels. When we eat carbs, our body produces insulin. Insulin then acts like a key that unlocks the cells in our body to allow glucose, or sugar, from the bloodstream to enter and be used for energy. In insulin resistance, the cells become less responsive to the effects of insulin. They don't allow glucose to enter as efficiently as they should. This means that even though insulin is present, it has trouble unlocking the cells to let glucose in, causing blood sugar levels to elevate. To compensate for the lack of responsive cells, the pancreas produces more insulin, trying to force glucose into the cells. This leads to higher levels of insulin in the bloodstream. Understanding insulin resistance is important because it can lead to weight gain, irregular periods, cysts on the ovaries, and an increased risk of developing type 2 diabetes. I'll discuss how to manage this and the other types later. The second type of PCOS is inflammation. Inflammation is very common in all women with PCOS. This type can worsen symptoms like fatigue, bowel issues like irritable bowel syndrome, headaches, joint pain, and skin issues like eczema or cystic acne. Chronic inflammation is linked to the ovaries making too much testosterone and causing high levels of fat cells that can affect your sensitivity to insulin, causing insulin resistance. So yes, one type of PCOS can lead to another type. So connected. The third type is adrenal PCOS. This type accounts for about 10% of PCOS cases. It's linked to increased androgen production, which leads to excess male hormones that can cause those undesirable symptoms like facial hair or hair loss. This type is often associated with high stress levels. Actually, one of the functions of the adrenal glands is to produce cortisol, also known as the stress hormone. This type is also associated with adrenal dysfunction, like tiredness and trouble falling asleep or waking up. The fourth and final type is post-pill PCOS. This occurs when PCOS symptoms temporarily emerge or worsen after discontinuing birth control. Ask yourself, were your periods normal before the pill or after? The sudden hormonal shift can disrupt the body's natural balance, leading to irregular periods and hormonal imbalances. Now you may be wondering, okay, now I know the type or types of PCOS I have, now what? How do I manage them? Well, first, always consult with your doctor. Sometimes there are cases where the underlying cause of PCOS remains unidentified. That's why it's important to talk to one, to investigate potential root causes such as thyroid disorders or genetic factors. Other than that, for insulin resistance, try focusing on a low glycemic diet. This diet helps to minimize spikes in your blood sugar and insulin levels. These foods can include green vegetables, fruits such as apples and strawberries, and whole grains. And what goes along with diet? You got it, regular exercise. This is key. For inflammatory PCOS, include anti-inflammatory foods like turmeric, ginger, and leafy greens in your diet. Also, you should check out if you're lactose intolerant or allergic to gluten. For adrenal PCOS, you want to make sure you are prioritizing sleep and managing your stress with things like meditation and self-care so that it can help regulate your hormone levels. For post-pill PCOS, working closely with a healthcare professional to restore hormonal balance is crucial during this change. Well, that's all for today's video. I hope this has shed light on the various types of PCOS you can have. Remember, it's important to work with a doctor to determine your specific type. Everyone's journey is unique, and the right treatment plan can be tailored to you. If you found this video helpful, please be sure to give it a like and subscribe to my channel for more PCOS related content. Until next time, stay positive and keep striving for PCOS wellness.